Have you ever had a headache that knocks you out of commission for the entire day? Your head drops, you feel nauseous, you can barely stand up straight or get out of bed. You look for a dark room and try to hide in it. Well, you're suffering from a migraine. Or is it really a migraine? Hi everybody, my name is Dr. Nicholas Chua. I'm the Medical Director and Pain Physician at Specialist Pain International Clinic. And today, we're going to talk about the various types of headaches that affects you either every now or then, or it is already a chronic problem. I would like to talk a little bit about migraine headaches. Migraine headaches are typically one-sided. It is often described as pounding or throbbing and often associated with nausea. You may also feel that sunlight or bright lights makes the headache worse, and you will tend to want to look for a dark room to hide or to sleep it off. And you may pop painkillers over-the-counter stuff that may often help. The problem is that when acute migraine becomes chronic, which means that you have more than 2 attacks a week, or you have a total of 5 attacks in a month, that's when it becomes a little bit more dysfunctional, and it will affect your quality of life. Luckily for us, in the last 5 years, the advent of very good medication known as CGRP antagonists has been the lifesaver for a lot of migraine sufferers, and this has actually changed a lot of lives. It literally revolutionized the migraine therapy in Singapore and around the world. Another common type of headache is known as cervicogenic headache. As the name suggests, cervicogenic headache actually originates from the cervical spine. When a source in the neck hurts, it can sometimes radiate up the back of the head. This is known as cervicogenic headache. Now, it can sometimes be confused with migraines because cervicogenic headache can also be associated with nausea sometimes. Well, luckily for us, cervicogenic headache is treatable. It is treatable when the source of pain in the neck is treated. Now, one of the common sources of pain in the neck is actually a facet joint, or in younger patients, the cervical disc. If you hear of patients with slip disc in the neck, this is one of the causes. Another common type of headaches that we see in Singaporeans are sinus headaches. Sinus headaches you may be very familiar with because every time you have a cough, cold, when your sinuses are choked up or you've got chronic sinusitis, you are familiar with that type of headaches. It's usually in the frontal regions or the side of your faces. Now, this is treatable. Family GP or your ENT surgeons who will give you a course of antibiotics if you have acute sinusitis, or treat with nasal inhalers with steroid sprays if you have more chronic symptoms. Last but not least, we want to talk about tension type headaches. It is very common, if not the most common types of chronic headaches. Tension type headaches, unfortunately, is very related to stress and anxiety. So if you are in a high stress job, if you are a professional with deadlines to meet, you can be sure that you will feel that type of headaches like a band around your head, tightening up as the afternoon or the evening comes by. Tension type headaches with many types of anxiety and stress related symptoms will require adjustments to your job, will require coping strategies, will require lifestyle changes. Now, all of you would know by now that if a headache is self-limiting, it goes away in a day or so. It's probably nothing to be too concerned about. But if you've got a headache that, number 1, wakes you up in the middle of the night, number 2, presents with some part of your body that's weak or numb, or you can't even get out of bed for a couple of days, or is associated with a fever, those are red flags. It's time to see your family doctor or even get yourself to the emergency department. If you do experience any of those symptoms, your doctor will order a CT scan or an MRI to actually rule out other organic causes. As you may know, there are 4 common types of headaches that we commonly see. There's solutions for each and every one of them, but sometimes you may want to seek out help if the symptoms are chronic or it's starting to affect your quality of life. Please feel free to visit our website or get in touch with us on the phone to make an appointment with Specialist Pain International Clinic.